Hi, my name is Lewis. I have tinnitus, and I'm going to go over the toolkit that has helped me reach habituation over the last 6 months or so.
Lewis, please take us back to those early days of what life was like before tinnitus and what were the first symptoms that you noticed when things started to get difficult?
Yeah, so my early days were pretty standard. I'm a single father. I have two young girls, so very rambunctious kids. Very standard. I work from home 40 hours a week, have activities, friends, family, you name it. I'm a big bowler, so enjoyed bowling at the time. So pretty standard stuff. I would run 4Ks with my daughter, go out and activities, you name it. So pretty standard single father life, just, working with my kids, having them as priority. And for me, I think my journey with tinnitus really began in about November of December of last year. So I was dealing with a lot of sinus congestion through most of 2022, and I live in Oregon, so it kind of comes with the territory of dealing with allergies and congestion and sinus stuff. But I would have this constant pressure, dry sinuses, you name it. And I ventured toward trying numerous different allergy medications, decongestion, sprays, you name it. I tried the whole gambit to see if I could relieve this pressure and the sinus issues I was running into. And if I had to guess, I'd say I likely led to maybe like a nasty sinus infection that possibly led to my tinnitus. But ultimately, I try not to dwell on that too much because I can only control what I can control. I don't want to labor too much on the past. But come February of the following year, so February of this year, 2023, my tinnitus definitely got worse after a couple difficult nights of sleeping. Went to my PCP, personal care provider, and asked him for a reference to an ENT. I wouldn't get one for about a month, so I asked him to kind of escalate it or do a quick meeting with an ENT. So got in there very quickly. They did the sound tests, in the silent chamber, looked at my ears, and everything was normal. I had maybe a little hearing loss in my left ear, but for the most part, my hearing was pretty good for my age. They couldn't see anything and was effectively told to, live with it, live with tinnitus. Wasn't given any guidance, wasn't given any recommendations, just said, hey, your hearing looks good. We kind of did our part. And at that point, I was okay for a month. My tinnitus was still consistent. I was still able to sleep and function for the most part, but I could definitely see it escalating over time. And it wasn't until end of March is when I noticed my tinnitus really start to get really bad. And April 1st is, I remember that the day, kind of April Fool's Day, is when my tinnitus kind of hit the wall. It got so overwhelming and so sensitive and so unmanageable that I could not sleep. And if anybody has known sleep, and if you can't sleep, you ever had a couple of sleepless nights, few sleepless nights, you know that tends to put you into a negative feedback loop. And on top of the tinnitus, being unable to sleep, my anxiety was just through the roof. My resting heart rate was in the 90s. My blood pressure was out of control. I could not function. I could not function as an employee. I could not function as a person. I couldn't function as a father. So not being able to function really doubles down with your anxiety and not knowing what to do in the future, right? You just constantly dwell on, hey, is this going to be my new normal? Am I not going to be able to go bowling? And am I not going to be able to care for my kids? And those intrusive thoughts just consistently were present in my mind. And it just caused so much anxiety that I was unable to focus on the future, was losing weight, unable to eat, you name it, went through the whole gambit of issues that many other sufferers of tinnitus kind of go through in that first stage, that stage one. So from there, I didn't really have much choice. I had to go to the ER. So my mom and brother kind of helped me, brought me to the ER. And I was telling them what was going on. My vitals were out of control relative to my heart rate, blood pressure. And at that point, that's where they gave me a hormone, prednisone, which seems to be pretty infamous for helping with stuff like this. That didn't really seem to help. It actually made me feel worse in general. And then while I was on prednisone, I actually got a staph infection on the back of my head. So it's like, fever, not feeling well with tinnitus, everything on top of that. So I had to go back to the doctor again, get antibiotics. And it was at that point where I got the antibiotics that I actually started to feel better. It seemed like my tinnitus was getting maybe a little better, but I was still dealing with so much anxiety, stress, you name it, unable to sleep. Went back to my doctor, and that's where they started prescribing me medication. They gave me alprazolam, which is Xanax for sleep. They gave me a propranolol, I think is how it's pronounced, for a beta blocker to get my heart rate down, which was super helpful. But I realized that those are not long-term solutions. Those are not going to help me in the long term. And I needed a more balanced long-term plan, right? I can't just rely on medication. Here in the States, we're so prescriptive when it comes to symptoms with medication that I didn't want to become that person. I didn't want to become dependent on alcohol, medicine, pills to tolerate tinnitus. It wasn't a thing I wanted to do. So that's where I started to explore online for methods, for things that I could follow through on. And that's where I found your YouTube channel, Silk. The silk noise specifically was a tremendous help, because being unable to sleep, I'm a side sleeper. I was unable to sleep on my side, and the noise therapy via the pink noise via silk was huge. But I was still having a lot of trouble falling asleep, and that's where I reached out to you and Treble Health for help, and it was just, yeah, good things from there.
Thank you, Lewis. What were those first signs that gave you hope that things could get better?
The early signs were really going onto the Treble Health channel and seeing the success stories that numerous other people had. And I knew at that point, it's like, hey, I could do this. I could move forward. I have something to look forward to. And I took it seriously, very, very seriously, and put together a plan on how I could improve my tinnitus. The first thing was getting my sleep under control. So I think there was one video that you did that really went over kind of the proper ways of being comfortable while you sleep. A dark room, cool temperatures, going to bed early, reducing the blue light that you get from screens. So I really took that to heart and was pretty militant with following through. So I did all of that, but I think the game changer at that point was really guided meditation. And it wasn't just breathing exercises, but it was also downloading the application Breathe, the application's Calm, and following through on the meditation pieces that dealt with anxiety, dealt with stress. That really helped kind of internalize what I was going through, accept where I was, accept the sound, accept the moment I'm in, and be okay with it. I think part of the journey with tinnitus is really accepting where you're at and controlling what you can now, not worrying about the future, and kind of deflecting your focus outward, like on your body or external sounds or things like that. That was huge. There were nights where I couldn't sleep and I would just meditate for hours. And that put me in such a calm state and relaxing state that even if I didn't sleep, I still felt rested. I still felt good. And after, days of doing that, whether it's during the day, during the night, things just slowly started to get better. But it was a very sequential process, right? It wasn't just meditation. It was the Bluetooth headband that I received from Treble Health that made it able for me to sleep on my side, which was a game changer. I did that numerous times, and I noticed over time I no longer needed the medication I was prescribed to fall asleep. And there were times where it was slow to come, but I would fall asleep naturally without needing, a headband or medications. And I would just have, pink noise playing in the background. And I knew at that point that's when I was on a journey to getting better.
Thank you. Could you please now explain your work with your Treble Health audiologist and what you learned while working with them?
Yeah, so I worked with Dr. Ramsey, who's phenomenal. And I think maybe she felt a little bad because when we first connected, she helped me, set up my maskers. And I do want to point out the maskers, like step one toward changing how I dealt with tinnitus. I still have them, and now I wear them every day. As soon as I wake up, I go to bed, you name it. So having Dr. Ramsey come in, work with me, understand where I'm at, and program the maskers was huge. But at the same time, I spoke with her and I said, hey, I'm doing this, I'm doing this, I'm doing meditation, I'm doing hobbies, I do paint by numbers, I walk, I exercise, I eat well, I don't drink, I don't smoke, you name it. And she's like, gee, Lewis, I don't know what to do to help. But I told her, it's like you being here, right? You listening and understanding, because you've had tinnitus, you know that the struggles I'm going through is therapy in and of itself. So just having that support system was huge, because after our first meeting, I had a string of 3-4 weeks that were really great, but I started to rebound. There was a time where the tinnitus was escalating, getting worse. And I reached out to Dr. Ramsey and said, hey, tinnitus is getting worse. I think I don't think this is working. And we connected, and it was just that reassurance of, hey, we were expecting this. We knew that tinnitus was going to come back, and that's a good thing. I think just that reassurance of her saying, hey, this is a good thing. It's your brain experimenting with the sounds, your new environment, and understand you're doing everything right. Nothing has changed with your ears. Nothing has changed with your environment. And know that you're just in a moment and things will get better. And that helped tremendously, right? And she was right. She was right. A few days later, things went back to normal at the time. I was able to work through the tinnitus and get through that difficult time. And that sage advice really stuck with me to where if I'm having a bad day, which are very infrequent these days, I think back as like, hey, I'm in a moment, it will pass. Go use my tools, whether it's Bluetooth headband, sound therapy, meditation, exercise, you name it. Just like I said, a whole gambit of things to try. I just realized like don't concentrate on the future, concentrate on the now and what I can control. So working with Dr. Ramsey has been phenomenal in that regard of just the reassurance and the guidance and the encouragement that I'm doing everything right.
And for those who don't know, Lewis mentioned different sound therapy options. Sound therapy is a modality to control tinnitus and to help retrain the brain. At Treble Health, we specialize in this, and everything at Treble Health starts with a complimentary telehealth consultation. You'll see a number on the screen right now. Feel free to give us a call or check the links below to schedule the consultation. Lewis, you obviously benefited from that consultation and receiving personalized sound therapy treatment. What else helped you get better?
Yeah, so I think what helped me is knowing what not to do. And I know that may sound like an odd answer, but there are so few resources to help with tinnitus that your first natural instinct is to go online, right? To search on things you do to help. And there's so much misinformation and poor information, people suffering truly, that I took their stories to heart to really know what not to do. You know, no drinking, no blaming, 5G or cable connections or your phone for that. What really helped me is kind of doing those general quality of life activities that have almost like an ancillary approach to your tinnitus, right? It's not going to directly fix or cure your tinnitus, but it's going to improve your overall health, your overall quality of life. So what I mean by that is, drinking water. When it comes to coffee, I drink decaffeinated coffee at this point, and I slowly started to reintroduce caffeine back into my morning routine. But it was half caffeine, half decaf, and I've kept up with that. And I kind of limit myself to 2 cups of coffee a day. I walk between 4 and 5 miles a day. So it's just those general quality of life things that anybody should be doing anyway that really help make me feel centered, help with my tinnitus in general. And really, when I'm having a difficult day, because you can't always avoid stress, you can't always avoid anxiety. It's all about distracting yourself with things that make you happy. You have to be patient yourself. You have to be patient with the process. And you have to really learn to love yourself and understand that you're going through a moment. So for me, it's really doing all of those activities that a normal person should be doing to better help themselves, to better keep yourselves healthy. But it's also having a regimented sleep routine. I no longer try to stay up too late. Nothing past 10:30, 11 o'clock. I'm in bed by 9:30. Put my kids to bed, read them stories. I'm in bed. And as soon as I'm in bed, that's my time to settle down, relax. I'm a big reader, so I'll tend to read about half hour, an hour before bed. I try to limit the blue light from screens, and I think that's big. It's just getting into those healthy sleeping habits and being consistent with it, right? You have to be consistent. If you're not consistent, it will derail your whole process. It could cause lead to difficult nights and difficult days. So if you have a regimen, if you have a process, stick with it. And again, sound therapy has been huge. There isn't a moment of a day at this point where I'm not listening to sound in some capacity, whether it's through my hearing, through the maskers, or at nighttime when I take them off. I'm consistently listening to sound. And that's really helped kind of speed up the process because, again, everything started in April, and here we're now, first days of October. And I've effectively reached stage 4 habituation, and it's stayed that way.
Thank you. Now, please tell us about where you are today. What does it feel like to be in stage 4 of habituation? And how does that compare to the early days when things were very challenging?
Yeah, it's huge. I never thought that back in April I would be where I am today and so quickly. I know this journey could take years, months, and you're going to run into ebbs and flows where you're going to have those bad days, you're going to have those good days. But where I am now, I'm able to go back to the daily activities that I was doing before tinnitus, and I'm actually to a point in my life where I feel so much better than I was even before the tinnitus. My allergies seem to be under control. I feel healthier. I'm able to do all the daily activities and normal stuff that I do with my kids. I ran a 4K on the 4th of July with my daughter, and that same night we had, fireworks in our neighborhood. And I was able to go out there and listen to the fireworks despite it being loud, despite the tinnitus that I had during the day, during the 5K. I was still able to do this. And even if the tinnitus was loud, I knew that, hey, it's okay. It's okay if it's spiking a little bit. I will get through it. I'm in a moment of time. I'm enjoying myself. But at the same time, if I need a moment to myself, I recognize that, hey, I need to take time to myself. I need to go off to the side and maybe rest, do meditation. It's important to recognize when you do need that safety net, the time to yourself to recover. So where I am now, able to do everything I was able to before this and more.
And what's the volume of your tinnitus? Lewis, could you please explain how the loudness and awareness levels of your tinnitus changed over time during the treatment?
Yeah, it varies day by day. So early on, I was definitely at kind of that stage two where the tinnitus was there. It was annoying. It interfered mostly through the day. And at that point, I would say it was like a five or a six pretty consistently. Where I am today, it varies from day to day, but I would say it gets no longer than maybe, or no louder than maybe a two, if that, right? And my tinnitus is odd because in the morning is when it's at its lowest, and it tends to increase during the day, and in the evening that's when it's at its loudest. And I use air quotes loudest because as of now, even when it's at its loudest, it's maybe a 1.5, maybe a 2, not interruptive, not overwhelming, not affecting what I do. And if it's bothering me, it's not more of like, oh my gosh, this is so annoying. I can't do anything. It's like, oh, there's my tinnitus. Hey, it's okay. I'll just distract myself or do something to kind of deflect my attention away. And I'm at a point now where, 90, 95% of my day is just normal. I don't even think of it. But when I do hear my tinnitus, I have to struggle to hear it at times. Like, for example, I woke up this morning and it was extremely low to the point where it was almost silent. And what I do is I immediately put in my maskers and modulate the sound right below the tinnitus. And I'm happy to say these days, when I put them in, I go the opposite direction of turning them down because my tinnitus is so low. Whereas early on, I would have to turn them up pretty high. But now I don't even think about it during the day. And when it's louder in the evenings, that's where I go back to my tools of sound therapy, turning on, your white noise machine, putting on your Bluetooth headband when you need it, and meditation. I can't encourage people enough to try meditation. It's awkward at first. It will take time to get used to. But once you get your rhythm down and once you get into the sequence of doing it, it helps so much.
Lewis, what advice would you give to someone else struggling with tinnitus?
Yeah, my advice is to encourage anybody with tinnitus to really concentrate on the now. Concentrate on what you can control, right? You can't control what happens in a week from now, a month from now, a year from now. And if you do try to concentrate on that, your anxiety and your stress will just get worse. And in turn, your tinnitus will get louder. It's like the infamous interview question. Where do you see yourself in 5 years from now? But instead, picture where you see yourself 5 hours from now. Plan your day with activities centered on your overall wellness, which includes exercise, hobbies, like reading. As you can see, I'm a huge reader. That's been huge with taking my mind off tinnitus as I'm able to imagine different scenarios and different stories, right? I do a lot of painting by numbers. That's extremely relaxing. Do hobbies that you love. Again, I'm a big bowler, so I love to go out and bowling. And initially, the bowling, the noise from that bothered me, but I'm to a point now where it doesn't. And if it does, I'm okay with it. I'm okay with it. I'm just happy that I'm able to go back to kind of a normal life. Spend time with friends and family and talk about tinnitus as a form of therapy. Talking through with friends that, hey, I have tinnitus and this is the journey I went through. I have maskers and you can see them. They're actually pretty cool. Taking away that stigma of mental health and saying, hey, I went through this journey. I'm better now. I want you to be mindful of your hearing and take care of your hearing. Along with that, it's the general quality of life activities that you do. You eat better, not because it could generally impact your tinnitus directly, but because it will improve your overall quality of life. Which has a proximity effect of helping to better manage your tinnitus. I would encourage folks to really shy away from drinking and smoking. Right, those tend to escalate tinnitus. So do your best to really quit smoking, quit drinking, reduce your caffeine intake. And again, I did that by introducing decaf into my routine. Just having a cup of coffee there, something warm, something satiating is huge. And if you have trouble with it, do it slowly. And, most importantly, don't hesitate to utilize the tools you have available to you. Guided breathing, meditations, therapy, you name it. And, at the end of the day, I think, and most importantly, just be kind to yourself and recognize that what you're going through is difficult and that you will get better, but you must put in the effort, you must put in the work to get there. I was of the mindset that screeching tinnitus and endless anxiety, no sleep, and being unable to function as an employee, a father, a person, wasn't in the cards for me. But with diligent work of utilizing your tools, relying on your audiologist for help when you need it, it pays off in spades. It'll take time, it'll be difficult, but you will get there.
Thank you so much, Lewis. On the screen right now, you'll see a phone number where you can call Treble Health and schedule your complimentary telehealth consultation to get help in a similar way that Lewis did. Lewis, we'll talk to you soon.